Every year, thousands of people over 60 walk into a clinic feeling completely fine and walk out with a diagnosis that changes their life. Not because they were sick, because they were tested for the wrong thing at the wrong time. Here is what 15 years of clinical practice has taught me that nobody explains clearly enough. After 60, the rules of medical screening change dramatically. The checkups that protected you at 40 can actively damage you at 65. Not because medicine is bad, because your body has changed. And the math behind every single test has changed with it. The scan that made perfect sense at 45 can trigger an unnecessary biopsy at 67. The blood test that was routine at 50 can launch a cascade of procedures, medications, and surgical referrals that do more harm than the condition they were supposedly catching. And the worst part, your doctor may never sit you down and explain why, because ordering a test takes 10 seconds and explaining why you do not need one takes 20 minutes that the system does not pay for. What you are about to hear are 5 specific medical checkups that I, as a physician, would personally refuse after 60. These are not fringe opinions. These are positions supported by major medical guidelines that most patients never hear about. Understanding them could save you from unnecessary surgery, toxic treatments, and years of anxiety over a problem that was never going to hurt you. This is not anti-medicine. This is medicine done correctly for your age. Before I name those 5 checkups, you need to understand one concept. Without it, nothing else in this video makes sense. It is called a false positive. In plain language, a test tells you something is wrong when nothing actually is. At 30, false positives are uncommon because your tissues are relatively clean and uniform. At 65, your body is a completely different landscape. Decades of living leave marks, small cysts in your kidneys, tiny calcifications in your lungs, a nodule on your thyroid. Slow-growing clusters of cells that will never cause a single symptom and will never shorten your life by a single day. These are normal features of an aging body. They are as ordinary as gray hair. But when a scan finds one, the system cannot leave it alone. One abnormal finding triggers a biopsy. The biopsy triggers a follow-up scan in 3 months. The follow-up triggers a specialist referral. The specialist orders a procedure. Each step carries its own risk: infection, bleeding, anesthesia complications in a body that handles anesthesia less well than it did 20 years ago, hospital-acquired illness. It is like pulling a loose thread on an old sweater. The sweater was perfectly fine, you could have worn it for years, but now it is unraveling, and you cannot stop it. Doctors have a term for this: overdiagnosis. That means finding a real condition, a real cyst, a real cluster of abnormal cells that was never going to cause harm in the patient's remaining lifetime. The condition is real, the diagnosis is accurate, but the treatment it triggers does more damage than the disease ever would have. This is the lens through which everything that follows should be understood. Every one of the 5 checkups I am about to name can be life-saving in the right patient at the right age. The question is whether you are still that patient. The first checkup I would refuse after 60 is the full-body CT scan marketed as a preventive health screen. I understand the appeal. Scan everything, catch anything early, walk out with peace of mind. It sounds like the most responsible thing you could do for yourself. But the reality inside that scanner is very different from the advertisement. A CT scan delivers a significant dose of ionizing radiation. That radiation damages DNA in your cells. At 35, one scan in a decade is a small addition to your lifetime total, and your DNA repair mechanisms are running at full capacity. At 65, after decades of X-rays, dental scans, chest CTs, and prior imaging, every new dose adds to a cumulative total that your body is less and less equipped to fix. The repair machinery itself slows with age. That is not theory. That is cell biology. But radiation is not even the biggest problem. The biggest problem is what the scan finds. A full-body CT in a 65-year-old will almost certainly find something. A 4 mm lung nodule, a small liver cyst, an adrenal spot, a kidney mass. The vast majority of these findings are clinically meaningless. They will never grow, they will never spread, they will never cause a single symptom. But once they appear on a radiologist's report, the system cannot leave them alone. Now you need a follow-up CT in 3 months, then another in 6 months, then a PET scan, possibly a needle biopsy. Months of anxiety, multiple additional radiation exposures, and an invasive procedure with real complications, all for something that was never going to become cancer. Targeted screening, where a doctor orders a specific test to answer a specific clinical question, that is medicine. A full-body scan with no question is a fishing expedition. And after 60, the lake is full of harmless fish that look terrifying on a screen. The second checkup I would refuse is the routine PSA blood test drawn automatically as part of an annual panel, with no symptoms and no conversation beforehand. Let me be direct. Prostate cancer is a real disease. It kills men. I am not dismissing it, but most men have never been told what a PSA test actually measures, and that gap in understanding causes enormous harm. PSA stands for prostate-specific antigen. It is not a cancer test. It is a protein produced by normal, healthy prostate tissue. Your PSA level goes up with age. It goes up with a urinary tract infection. It goes up with benign prostate enlargement, which most men over 60 already have. It goes up after vigorous exercise. It can go up after sitting on a hard surface for a long time. An elevated PSA in a 65-year-old man can mean a dozen completely different things, and cancer is only one of them. Here is the part that should genuinely concern you. Autopsy studies have examined men over 70 who died of heart attacks, strokes, pneumonia, causes that had absolutely nothing to do with their prostate. A striking number of those men had cancer cells present in their prostate tissue. Those cells were never going to kill them. They would have lived full lives and died without ever knowing those cells existed. But if a routine PSA test finds an elevation and a biopsy confirms cancer cells, the system activates surgery, radiation, hormone therapy. These treatments carry real side effects, incontinence, impotence, fatigue, consequences that permanently alter a man's quality of life. I am not saying never test PSA. I am saying a PSA test should only happen inside a specific, informed conversation where your doctor explains what an elevated result will trigger, what it will lead to, and whether you want to walk down that road. A routine PSA drawn with no conversation is not prevention. It is a trapdoor. The third checkup I would refuse is the routine cardiac stress test, treadmill or nuclear, performed as an annual screen when I have no chest pain, no shortness of breath, and no symptoms whatsoever. A stress test measures whether your heart muscle gets adequate blood flow under exertion. When a patient walks in with chest tightness climbing stairs or unexplained shortness of breath at rest, a stress test answers a critical clinical question. It can be life-saving. I have seen it save lives. That is not what I am talking about. I am talking about the version where a perfectly healthy 63-year-old shows up for a routine physical. The doctor says, let us just run a stress test to be safe. And now that patient is on a treadmill with electrodes on their chest and no clinical question being asked. Here is the problem. The test has a known false positive rate. In a person with real symptoms, an abnormal result very likely points to real disease. In a person with no symptoms at all, the math flips. The chance that an abnormal result is a false alarm climbs significantly, and an abnormal stress test, even a false one, almost always leads to the next step: cardiac catheterization. A catheter threaded through a blood vessel directly into the heart. That procedure is generally safe, but it is not without risk: vessel damage, bleeding, allergic reaction to contrast dye, in rare cases, stroke. For a patient with crushing chest pain, who needs answers, that risk is justified. For a patient who felt perfectly fine walking in that morning, that risk was created entirely by the test itself. The real tools for protecting your heart after 60 are not dramatic procedures. They are the basics. Blood pressure tracked consistently, not just at the office when you are already nervous. Lipid panels interpreted in context. Blood sugar monitored over time. An honest conversation about family history and lifestyle. These catch real risk. A routine stress test in someone with no symptoms catches anxiety. And that brings me to something I would say to you if you were sitting across from me right now. You just heard that the most important cardiac screenings after 60 are not expensive procedures. They are targeted, consistent monitoring. Blood pressure, cholesterol, blood sugar. Cardiac screenings match to your actual risk profile. Most people hear that, agree with it completely, and then do nothing. They watch the video, feel informed, and go back to their day with no plan. Here is what I would tell any patient of mine. There is a free platform called Care Health that connects you with healthcare options, preventive screenings, and clinical trials in your area, including cardiac screening programs, blood pressure monitoring, and new treatments for heart disease. You fill in a short form, your date of birth, your gender, whether you have children under 18. It takes 30 seconds, costs nothing, and requires no commitment. Care Health matches you with relevant options near you. Click the link in the description below or scan the QR code on your screen right now. Just open your phone camera and point it at the code, 30 seconds. That is the difference between knowing what to do and actually doing it. Now back to what you need to know, because the next two checkups on my list surprise almost everyone. The fourth checkup I would refuse is the massive annual blood panel, where 30 or 40 markers are drawn at once with no specific clinical question behind any of them. Let me be clear. Blood work is essential. I order blood tests every single day. What I am against is the way they are commonly ordered after 60. Everything, all at once, no context, and results mailed to the patient as a printout with highlighted abnormals and zero explanation. Here is the statistical problem nobody walks you through. Normal lab ranges are set so that 95% of healthy people fall within them. That means for each individual marker, there is a 5% chance of a flagged result in a person who is completely fine. 5% sounds small, but run 40 tests on the same person, and the probability that at least one comes back abnormal approaches near certainty. It is math, not medicine. Then comes the phone call. Your such and such level came back a little high. We want to retest. Now you are anxious. You Google it at midnight. You find the worst case scenario on the first page. You do not sleep. The retest comes back completely normal 2 weeks later, but the damage is already done. The stress, the cortisol spikes, the sleepless nights, that is not prevention. That is iatrogenic harm, harm caused by the medical system itself. A smart blood panel, after 60, looks nothing like that. It is targeted. It answers specific questions based on your history, your medications, your risk factors. A diabetic needs HbA1c and kidney function markers. A patient on statins needs liver enzymes and a lipid panel. A person with persistent fatigue needs thyroid function and iron studies. The right tests for the right person, interpreted by a doctor who knows your history and explains every result. Not a scattershot lab order run through a machine with no conversation attached to it. The fifth checkup I would refuse is the routine screening colonoscopy after 75 in a patient who has had consistently normal prior screenings. This one requires careful framing because colonoscopy is one of the most genuinely life-saving screening tools in medicine. It catches colorectal cancer early. It removes precancerous polyps before they ever become dangerous. Between the ages of 45 and 75, for average-risk individuals, screening colonoscopy saves thousands of lives every year. I am not questioning that. What I am questioning is the automatic scheduling of that same procedure after 75, when 2 or 3 prior screenings have come back clean, and nobody has explained to the patient that the guidelines have shifted. Here is the biology. The progression from a benign polyp to a dangerous colorectal cancer typically takes 10 to 15 years. In a 76-year-old with 2 prior clean colonoscopies, the probability of a brand new polyp developing and becoming clinically threatening within their remaining life expectancy is very low. The math that made the test clearly beneficial at 55 no longer looks the same. Meanwhile, the risks of the procedure itself climb with age. Bowel preparation, the aggressive fluid and laxative regimen the night before, can cause dehydration and electrolyte imbalances that an older body tolerates far less well. Sedation carries higher anesthesia risk after 75, and the small but real chance of bowel perforation during the procedure increases as the colon wall thins with age. At 50, the benefit of catching a polyp overwhelmingly outweighs the procedural risk. At 80, with 2 prior clean screenings, that balance may have tipped the other way. This is a conversation you and your doctor should have explicitly. It is not a test that should be automatically scheduled because the calendar says it has been 5 years. Now that you know what to question, let me tell you what I would insist on. Because the goal here was never to test less. The goal is to test smarter. The first thing I would want is consistent blood pressure tracking at home. Not a single reading at the doctor's office when you are already anxious, sitting under fluorescent lights after rushing through traffic to make your appointment. That reading is almost meaningless. A home blood pressure cuff used 3 to 4 times a week, at the same time of day in a calm setting, gives you and your doctor a real picture of what your cardiovascular system is actually doing. The second thing is targeted blood work, ordered by a doctor who knows your history and explains every single result. Not 40 markers thrown at a lab, the specific tests that answer the specific questions your body is raising right now. The third thing, and this one surprises people, is a genuine medication review. Not what are you taking, but do you still need to be taking this? Polypharmacy, meaning 3 or more prescription medications taken simultaneously, is one of the most underappreciated dangers after 60. Drug interactions accumulate silently. Side effects get mistaken for new symptoms, which trigger new prescriptions, which create new side effects. A doctor who removes an unnecessary medication is doing as much for you as a doctor who prescribes the right one. The fourth is bone density screening. If you have risk factors for osteoporosis, a fracture after 65 is not just an inconvenience, it can be the event that permanently changes your mobility and independence. And the fifth is vascular screening. If your risk profile warrants it. Carotid ultrasound, ankle brachial index. Lipid panels interpreted alongside your family history and your lifestyle, not just compared against a generic reference range on a printout. Every test should answer a question. If no question is being asked, the test is not prevention. It is noise. You might be wondering, if over-testing causes this much harm, why does it keep happening? The answer is not that doctors are careless. The answer is that the system they work inside makes the wrong choice the easy choice. A typical office visit after 60 lasts about 12 minutes. In that window, your doctor reviews your chart, asks about your current symptoms, checks your vitals, and makes decisions about medications and referrals. Ordering a test takes 10 seconds. One click in the electronic health record, done. Explaining why a test is not needed, walking you through the false positive risk, the procedural cascade, the overdiagnosis math, that takes 15 to 20 minutes the schedule does not have. Then there is defensive medicine. Doctors know that if they skip a test and something is found later, they may face legal consequences. If they order the test and it leads to unnecessary harm, the legal exposure is far lower. The system punishes under-testing far more than it punishes over-testing, so doctors order. Not because you need it, but because the system incentivizes it. And then there is you. Many patients equate good care with more tests. When a doctor says you do not need that scan, it can feel like dismissal, like they are not taking you seriously. That instinct is understandable, but it is backwards. A doctor who says you do not need that test may be protecting you from the exact cascade we discussed at the beginning of this video. Here is what I want you to do. Before your next appointment, write down your current concerns, your symptoms, every medication you take, and your family history. Bring that list and ask one question. Based on this, what do I actually need to be screened for right now? That single question changes the entire dynamic of the visit. Here is exactly what to do after this video. 5 steps, all of them free, all of them within your control right now. Step 1. Before your next appointment, write down every medication you take, every prescription, every supplement, every over-the-counter pill, including the ones you think do not count. Bring that list and ask your doctor one direct question about each item. Do I still need to be taking this? You will be surprised how often the answer is no, or we should have stopped that a year ago, or that one is actually causing the symptom you came in about last time. Step 2. Ask your doctor which screenings are specifically recommended for your age, your sex, and your personal risk profile. Not a general panel, not everything just to be safe. Targeted tests with clear reasoning behind each one. If your doctor cannot explain why a specific test is being ordered for you specifically, that is important information. Step 3. If your doctor orders any test, ask 2 questions before you agree. What are we looking for? And what will we do if the result comes back abnormal? If there is no clear answer to both, that test deserves a second thought. Those 2 questions alone will protect you from more unnecessary procedures than any second opinion ever could. Step 4. Get a home blood pressure cuff and learn what your numbers actually mean. Track them 3 to 4 times a week, same time of day, sitting calmly. A consistent home log is more valuable to your doctor than a dozen office readings taken when you are already stressed, running late, and sitting under fluorescent lights with a sleeve squeezed around your arm. Step 5. Stop equating more tests with better care. That instinct is deeply ingrained and completely understandable, but after 60, it can actively work against you. The goal is not to find everything, it is to find the things that matter and act on them intelligently. Stepping back from all of this, I want to be clear about what this video was and what it was not. This was not a case against medicine. This was a case for medicine done correctly for your age. The body after 60 deserves respect, not panic. It deserves a doctor who asks specific questions, orders specific tests, and explains every result in plain language. not a system that runs you through a conveyor belt of scans, panels, and procedures because the calendar says it is time or because nobody took 15 minutes to explain why a test was not needed. Smart screening, targeted testing, and an honest conversation with a doctor who knows your history are worth more than 100 unfocused scans. The 5 checkups we covered today are not bad medicine. They are good medicine applied at the wrong time, to the wrong patient, without the right conversation. That is the difference. And remember, that free health screening link is in the description. 30 seconds to fill in the form, and Care Health matches you with screenings, clinical trials, and healthcare options near you. Take care of yourself.